Hello, I'm Dr. Caleb Dresser. I'm an emergency physician practicing at Beth Israel Deaconess Medical Center in Boston, Massachusetts. And I'm going to be spending a few minutes with you today talking about the specific impacts of climate change on various health effects, including various organ systems in the human body. The talk is divided into two sections. This is part one. I have no financial disclosures or conflicts of interest relevant to this talk. To begin, we want to understand connections between climate change and health, and we need to think about a couple of pathways that connect human activities, such as the burning of fossil fuels, with impacts on human health. First of all, some of these activities, which include things ranging from the combustion of oil and gas to deforestation to things like certain agricultural practices, can result in the buildup of greenhouse gases in the atmosphere and thus changes in the climate. These in turn can have effects on a variety of hazards ranging from flooding risk and severe weather to changing temperatures and natural biome changes, and these in turn can lead to impacts on human health. It's important to also recognize that even without considering the climate change implications of some of these activities, things like the burning of fossil fuels also lead to particulate pollution in the air, which has direct impacts on human health. As we go through the examples in this talk, which cover a large number of different organ systems and different climate change effects, it's important to understand that there's a fairly substantial evidence base supporting the connections between climate change and these health impacts. Full list of references is available in the textbook chapter listed on the slide, and the evidence base is quite large and spans every continent except Antarctica. For a little bit of scientific background, just to make sure we're all on the same page about the climate system and the background there as it relates to health, we have had ongoing use of fossil fuels to power energy systems and transportation in a variety of contexts. This has led to the buildup of greenhouse gases in the atmosphere, including carbon dioxide and methane. This, in turn, acts as an insulating blanket around the planet, resulting in increased global temperatures. And the expectation is that the warming of the planet will continue in coming decades. It is important to note that how much the planet warms depends greatly on policy decisions that are being taken now. As warming occurs, it has a variety of effects on systems that result in health hazard exposures. And these range from severe weather events such as hurricanes to heat waves to longer-term changes in things like ocean acidity or plant biology, which can have implications for things like food security. When we start trying to connect the dots, this turns into a very complex situation. This is a figure I developed a couple of years ago, and each arrow in this figure is supported by at least one peer-reviewed scientific journal article or government report. But there's a lot of complexity here, right? These are multi-step processes, and the number of different organ systems involved is quite extensive. And so rather than trying to untangle the causality in this at one go, what we're instead going to do today is speak about a short list of organ system impacts and talk about how those are affected by climate change one at a time. And we will continue this list in the second half of this talk in a separate slideshow. The first climate-related health impact that we should focus on is heat-related illness. This is in many ways the simplest connection to understand. As the planet is warming, temperatures are going up. This translates into increasing risk of heat waves, and even if you look purely at historical data, there has already been an increase in the United States in the frequency of heat waves and the length of the season in which they occur. High temperatures are obviously dangerous to the human body and can lead to conditions such as heat exhaustion and heat stroke. And from a healthcare provider standpoint, it is important to have systems in place to recognize patients who are affected by heat-related illness and be able to provide care. From a public health standpoint, it's important to focus on primary prevention of these potentially catastrophic health emergencies. Diving in a little bit to other effects from heat, there have been large-scale studies that have linked heat with myocardial infarction, also called heart attack. And this is something that is seen at both ends of the temperature spectrum. So very cold weather is also associated with increased MI risk. But in a warming world, it's heat that we are most concerned about. And this is an issue that we need to be cognizant of. Air quality issues also appear to be linked with rates of myocardial infarction. And the air quality issues at stake include things ranging from ozone and particulate matter, which can be related to human transportation or energy systems, as well as things like wildfire smoke that may be responsive to drying and warming in the environment resulting from climate change. Atrial fibrillation, which is an irregular heartbeat that can result in a variety of health complications, is also impacted by heat and particulates. And there are large-scale studies linking heat and AFib, as well as EMS utilization for atrial fibrillation. Asthma is a common illness affecting both children and adults, and is impacted through a variety of mechanisms as it relates to climate change. First, heat and humidity and rainfall have all been linked with increased asthma-related hospitalization rates. Second, increasing pollen levels are also linked with asthma hospitalizations. And when you look at some of the plant science data, it does appear that particularly in the temperate zones, the increasing length and intensity of pollen seasons related to climate change may be a pretty significant hazard for people with asthma. Finally, air pollution, including the ongoing use of fossil fuels and things like transportation, as illustrated in this image, is a significant concern for asthmatics, and on poor air quality index days, the use of air filters or particulate masks may be protective. Eliminating air pollution sources is, of course, a more effective long-term strategy for protecting patients with asthma, or even preventing patients from developing asthma. COPD, or chronic obstructive pulmonary disease, is another respiratory condition. This typically affects older adults, often smokers, and has similar risk factors to asthma in terms of exacerbations. This is a common cause of emergency department visits and hospitalizations, and is a big opportunity to protect health by reducing particulate emissions into the atmosphere from our energy system and our transportation system, and by taking steps to protect patients from the impacts of poor air quality. Pneumonia, which is an infection of the lung, as illustrated in this chest x-ray, is a more complex disease to think about as it relates to climate change, in that there are a variety of different mechanisms that could link these. There have been linkages demonstrated between rates of pneumonia and other pulmonary diseases and natural disasters, including cyclones, typhoons, hurricanes, and flooding. As we see increasing severe weather from climate change, this is something that responders and healthcare providers in affected areas will need to be alert to. There's also some interesting research linking harmful algal blooms and some of the brevetoxins, which can actually aerosolize from the water, with pneumonia rates and emergency department presentations for pneumonia during red tide events. That research was conducted in Florida, but may be relevant in other settings as well. And then there's quite a lot of work that has been done looking at air pollution, things like ground level ozone, particulates, and linking those with pneumonia rates. And then finally, there is a link between malnutrition or famine and pneumonia. It is plausible that this could be a further implication of food security issues that result from climate-related crop failures, although further research is needed to really establish a causal connection. There are also some atypical infections that can affect the lung that are worth being aware of, things like coccidiomycosis, pneumonic plague, and hantavirus. And in these, the climate component is important to think about. For coccidiomycosis, this is often an infection that is attached to dust, and so as a region dries and dust storms develop, or soil that had not been previously up and about in the atmosphere is now getting out into people's lungs, there are opportunities for this infection to establish itself. And so with warming and drying resulting from climate change, outbreaks are a concern. Hantavirus and plague, on the other hand, are infectious diseases that are largely related to rodent populations in certain regions around the world where these infections are endemic, and disturbances in food supply or other environmental triggers of rodent migration or movement into contact with humans have been linked with outbreaks of these diseases. Moving on to the kidneys, there are both short-term and long-term implications from climate change. And if we think about climate change as including a lot of impacts on water and a lot of impacts on temperature, it's fairly clear that the kidneys, as a key body system for regulating salt and electrolyte and water balance in the body, are going to be affected. Short-term, the heating and potential for reduced access to water or cooling means that acute kidney injury is certainly a concern. There have also been some studies linking increases in kidney stones or renal colic with higher temperatures, presumably related to dehydration, intravascular volume depletion. And similarly, urinary tract infections in a couple of studies have been shown to go up during hot weather as well, again, likely because of dehydration and decreased urine flow through. So all of these are issues that can be potentially addressed through better hydration, better access to cooling, but are likely to be climate responsive on a large scale over time. An additional concern long-term is chronic kidney disease of unknown origin, or CKDU. This remains an area of active research, and the causal mechanisms are not fully understood, but there does appear to be some relationship, at least in some settings, between high temperatures, physical exertion, and the development of renal failure in young, active agricultural laborers. And so this is an area to stay alert to in terms of ongoing research that connects some of these climate-related exposures with a potentially debilitating or, in many settings, deadly disease that can affect people in the prime of their lives. From a neurologic standpoint, temperature and particulates both affect inflammation, and this can in turn affect a variety of neurologic systems. Particulates, which can result from both the use of fossil fuels in energy systems or transportation, as well as from things like wildfires, which are becoming more common in many regions as a result of climate change, have been linked with increased stroke risk. And heat has also been associated with increased stroke risk in some urban centers. And so more research on this is probably needed, but it does appear that during hot weather and high particulate environments, there is increased risk of acute CDA. Patients with dementia are another concern. I have not identified evidence in my literature reviews linking the development of dementia with climate change, although there is some interesting literature around particulate exposure, for example, from fossil fuel use. But there is fairly substantial evidence showing that for patients who already have dementia, there is a pretty significant effect on mortality and morbidity when they are exposed to climate-related hazards such as heat. And this is likely in part because of decreased ability to take adaptive actions such as maintaining hydration or seeking cooler environments. And so for elders with some degree of cognitive decline, having social supports in place and clinicians who are alert to these issues is very important. Food security is also going to be an increasing issue as climate change affects agricultural systems around the world. And in certain settings, this can result in toxic ingestions of what are essentially emergency food sources, things like bitter cassava and grass pea, which may not be the preferred food source during times of plenty, but may be a fallback food source during periods of drought. And these can result in long-term devastating neurologic conditions. And so developing systems to address food security and anticipate impact on agriculture is going to be quite important to avoid these. Another food system that's potentially impacted by climate change is that of large pelagic fish. And what can happen is that the toxic blooms of algae that occur lower in the food chain can actually result in bioaccumulation of toxins in larger tropical marine fish, leading to a condition called Ciguatera poisoning, which can have some fairly concerning and debilitating neurological effects. And there is concern that as warmer ocean temperatures lead to dinoflagellate blooms, there may be an increase in Ciguatera poisonings in some settings. Research on this is ongoing, and there remains some active debate in the scientific literature. So that concludes the first half of this talk. I want to thank my colleague Dr. Sachit Balsari, who co-authored the textbook chapter that this talk is based on. And I want to thank the editors of Global Climate Change and Human Health. I welcome any questions or inquiries. This is my contact information, and thank you for listening, and thank you for your time.